Your child has just been diagnosed with ADHD. You might feel a mix of relief, confusion, and maybe even fear. So you're wondering, what's gonna happen next? Do we start with medication? Do we wait? What could we do at home to help my child? If this is where you are right now, take a deep breath. You're not alone. Today, I'll share with you 3 key steps that can help you support your child whether or not you decide to start with medication. Hello, I'm Madam Han. As an ex-primary school teacher who has worked with children diagnosed with ADHD, I've seen firsthand that this diagnosis is not the end. It's actually really the beginning of understanding how your child's brain works best. I've helped children who struggle to focus in and outside of school, helping them to sit still or to manage emotions. And what I've learned is this: ADHD is not just about attention, it's about regulation, sensory, emotional, and cognitive. So let's talk about what we could, as parents, do after that diagnosis. And how could we move forward with confidence? Step 1. Understand your child's sensory needs. When I first started working with ADHD kids, I realized something quickly. Many of their behaviors, they were not about defiance. They were more about unmet sensory needs. You see, some of these kids, they crave movement, jumping, spinning, or tapping. Their bodies are asking for regulation. Well, there are some others who are hypersensitive. They're easily overstimulated by noise, by the ceiling lights in the classroom, or by touch. So that is why one of the first things I help parents do is to discover their child's sensory profile. What is this, you may ask? So according to Sensational Kids, an occupational therapy service provider based in Ireland, a sensory profile assesses how individuals process sensory information from the environment. It gives the therapist insights into an individual child's sensory preferences, what is his sensitivities and challenges, helping to create a really personalized strategy for that unique child. So, I would really suggest for you to observe what calms your child versus what overstimulates them. We could introduce a simple sensory diet, a planned sensory activity list through the day. It could be things like wall pushes before homework, swinging, or deep pressure hugs after school, even using of fidget toys, using seated tasks. When we meet those sensory needs, the child's brain becomes calmer and attention naturally improves. Occupational therapists call this the sensory integration approach. Studies have shown that tailored sensory activities have helped improve focus and reduce disruptive behavior in ADHD children. Step number 2, cater to emotional needs. Many ADHD kids, they do not have a motivation problem. They have a regulation problem. When emotions surge, reasoning and focus drops. So before we expect self-control from them, we have to help them feel safe and seen. So what you could try at home is to keep routines predictable. Transitions are really hard for ADHD brains. Use co-regulation. Parents, we need to allow our child to borrow our calm. So we first need to slow down, breathe slowly, and help them to name their feelings. You're frustrated because homework feels hard right now. Celebrate small successes, not just compliance. I've seen so many students transform when adults shift from managing their behavior to supporting regulation. Dr. Mona Delahooke, author of Brain-Body Parenting, explains that emotional safety activates the thinking part of the brain, the very part that helps ADHD kids focus, plan, and to learn. Step number 3, medication or not? This is the question almost every parent that works with me asks me. Should my child start with medication? Here's the truth. There is no one-size-fits-all. Medication can be incredibly helpful for some children, especially when ADHD symptoms severely disrupt learning or the daily functioning. Now, for others, lifestyle and environmental changes could make a meaningful difference before introducing medication. And I've seen both paths work. Some families, they start medication and they see major improvements. Others, they focus first on structure, sleep, nutrition, and sensory regulation. And that stability alone makes huge progress. So rather than rushing the decision, start with observing. Start with openly communicating with your healthcare provider. You can always add medication later, but you cannot undo a rushed choice that is made in fear. If you're not comfortable with medication right now, here's what to focus on: sleep hygiene. ADHD brains, they need more rest than they let on. Physical movement, 30 to 60 minutes daily. It helps to reduce impulsivity. Protein-rich meals. This helps to stabilize the dopamine levels naturally. Structured routines and visual schedules at home. There is a multimodal treatment study of ADHD found that the most effective long-term outcomes came from a combination of behavioral interventions and medication. Meaning even when medication helps, home and school strategies still matter just as much. So, if your child has just been diagnosed with ADHD, here's your 3-step plan. Number 1, understand their sensory needs. Behavior is communication, whether ADHD or not. Number 2, cater to your child's emotional needs. Emotional co-regulation first. Number 3, decide about medication mindfully. Observe, discuss, and choose what aligns with your comfort level and what your child needs. An ADHD diagnosis does not define your child. It gives you the roadmap to understand your child better and to create an environment where they can thrive both emotionally and academically. Is this a decision that you're navigating right now? What has been most confusing or challenging for you? Share your story below. Help another parent who feels alone in this process. If this video gives you clarity or comfort, click like so more parents can find it, and subscribe for more calm, science-backed strategies to support your child's growth and confidence.